went in to see this patient a while ago, and when I went in to see the patient has a caregiver who is a relative, but also the patient assigned home health aide. When I went in and saw the patient first said to me that, "Oh, nurse, I need to be changed. I haven't been changed from morning." The home health aide that was sitting there said to me that, yeah, she bathes the patient, but she doesn't change the diaper. I was like, I don't really understand. She's like, yeah, the wife normally does that in the morning and when she gets home, but she doesn't do anything to do below with the waist. I was like, that's weird. Like, how can you, in my mind, I'm like, how can you be bathing a patient but not changing the diaper? You're not getting, it's not like free work you're doing. You are assigned by the home health services that we are working with. So you're getting paid by the insurance company to take care of this patient, but yet still you're saying that you'll sit down with this patient throughout the night, and in the morning when you're supposed to be bathing the patient, changing the patient, you don't want to change the diaper, do any form of perineal care, nothing like that. So this patient is telling me that he pooped this morning, but the wife told him that I am coming in to see him so I can change his diaper. I don't know how many persons as nurse practitioners are out there, or how many persons I've heard about nurse practitioners going into the homes of patients and be changing, diaper. And don't get me wrong, yes, I am a nurse and I don't have any problems with changing patients' diaper, because I've been to homes of patients where they don't have any assigned, caregiver, or even if they have assigned caregiver, home health aides, they're not there at the time when I'm going to see them, and the patients are soaked. But I'm not the kind of person that is going to go there and see those patients struggling to change themselves and I cannot help them. No, it's in my nature. I'm a nurse. I'm human as well. So I am going to go and help them as best as I possibly can once I have at least a glove. Because I have, the basic PPE. I have a glove that I can use to help with changing these patients. But it's unfair for us as nurse practitioners or nurses or caregivers, healthcare providers, to go in and have family members, or not even family members, persons who are acting in the capacity as home health aides, you understand? And then to be saying that there are certain duties you're not going to be doing. Like, what is the purpose of you being there then? You're getting paid for the service. When I am working in the hospital as a nurse, like, I can't tell the patients or I can't tell my boss that these are things that I'm not doing because it's within my scope. You understand? So what's the sense you're taking up a job and you know that you're related to the person, but yet still you don't want to go below the waistline? Like, what's the purpose? So I said to them, like, okay then, so if you poop from this morning and your wife left you and your caregiver is sitting down with you from morning, it's after 9, you understand, it's almost 10 o'clock, and your wife is not coming back from school until later on in the evening. So you're telling me that you're in poop and this caregiver is sitting in a recliner covered in a blanket, and she's going to be there with you for the entire day, lying in poop until your wife gets home? That is just unfair. It is just so unfair. And the thing about it is that when you have, patients in the hospital, because I remember when I'm in the hospital working in the emergency room and you cannot find the time to change a patient in 2 minutes after they poop, it's a big write-up. And I'm not justifying not changing the patients on time. I'm just saying that when it comes on to whether or not you're getting paid, whether or not you're related to the person, we're supposed to be still giving best care. Best care is not supposed to be something that is only for healthcare professionals. It is supposed to be for the relatives in the home, the loved ones that are taking care of these patients as well. It's your responsibility as well. It's not only for healthcare professionals. It's not only for healthcare professionals. So if in the event that you're taking care of your loved one out there, I highly encourage you. I'm not supposed to tell people that you're supposed to be taking care of your loved one as well. Now, because you have a home health aide that is assigned, it doesn't mean that you cannot do certain things. Whatever you can do, you help out. In nursing school, we're taught, do what you can to help the patient, and you're not going to do what the patient can do for themselves. And it's the same thing that goes for the relatives. In nursing, we're trained to do whatever the patient cannot do for themselves. We're not going to go into the room and sit down and see the patient and have the patients be lazy with their care. Whatever the patient can do, because discharge teaching starts from where? As soon as the patients get into the hospital. That's when discharge teaching starts, you know. So I prep the patient from the time them get into the hospital. You understand? So we're actively getting you ready for home. So we're not having, so we don't have patients coming in and expecting to be just lazy, lying down in bed, not doing anything for themselves. So we encourage participation in their care, and it's the same thing when they're in the home. We encourage patients in the participation in their care, the family members' participation in the care, so that way the outcome for the patient can be better, and you don't have burnout with the staff that is coming in. Because when you have this, when everybody is relying on healthcare professionals to do every single thing, what is going to happen? Everybody's going to be burned out. And then when people really need the care, they're not going to have healthcare professionals coming in to do it. And that is one of the reasons why I feel like a lot of healthcare professionals are moving away from nursing, because nobody wants to actively participate in the care of these patients. Patients don't want to take up the responsibility for their own health care. Family members have zero interest in some of their relatives. Kudos to the ones that have, family members that are actively involved in their patient care. Because the other day I went and saw a patient, and I tell you, the patient has about 12 different referrals, and she has appointments set up for every single referrals that was assigned to her. And I had to tell her that me respect her for that, because I've never seen one patient with so much referrals and has appointments scheduled to see them. That is how good her family member is in terms of her health care. They're really, really involved in her health care. And when you have family members who are so involved, you have to pick them up. I had to, show her that it's not often I see that. It's not often I see that. So when I see healthcare professionals out there, people acting in the capacity of healthcare professionals, they're supposed to be doing their duty. They're supposed to be doing their duty, and they're acting like they don't know what their scope of practice is. You understand? They're acting like they don't know their scope of practice, and then expecting me or other healthcare professionals who are working in different scope to be coming into the homes thinking that we're supposed to be doing certain things on behalf of the patient. Yes, we do love our patient and we do care. I don't see doctors going into patients' home and I change diapers. I don't see doctors going into patient home and I give bed bath. Not because we are trained to do so, it doesn't mean that if we assign somebody and the person is not in the mood, that they don't feel like they want to do it because they're related to the person, then when I go in or the person go in to see the patient as a part of their monthly duty as a primary care provider, it's their responsibility to do it. It's not our responsibility to do it. So I feel like sometimes healthcare providers or healthcare professionals in different capacity totally forget about the different roles and responsibility, and especially when it comes on to who they're working with as well. The family members, they're not aware of the different roles and responsibilities of the persons that are coming in to their homes, and so the expectations of these family members, the patients, when you get into the homes, it is so different. You understand? And it makes it seem as though you're not a good nurse or nurse practitioner or healthcare provider. You understand? That's how it seems, because when I say to the gentleman that unfortunately I'm not going to be able to change you, I'm not going to be able to do it because you have a home health aide here.
Keep right.
You have a home health aide here. She says that I don't do it. He's going to look at me and tell me that, well, you're not a nice nurse. You're not a good nurse practitioner. I had to just smile. You understand? And just continue with my nursing duty. I had to just smile because I don't really know what else to do. And I don't want anybody to come and say in the comment box that, yes, you're not a nice nurse practitioner, because let me know how many persons would have done that. You know, if you're going to see a patient in the capacity of a nurse or a doctor, and you are now being told that you have other duties to do, when you have somebody that you have referred the patient to get that service, the patient has gotten the service, you understand, and the patient provider is there at the bedside, but a portion of the service that provider is supposed to be doing, you understand, they are not doing it because they're related to the person. Like, what sense then the person would have taken up the responsibility? Because we know that whenever you have patients in a home setting and they're elderly, one of the most important thing for them is what? They want a good bath. They want somebody to bathe them. That is the most important thing, you know. A lot of them can't take their own medication. You just need to give them medication in a cup and say take it at this time. But when they pee and poop, that is the most important thing, because that is going to contribute to what? Skin breakdown. We need somebody there to help with changing them. We don't need somebody there to be sitting down and looking at them for the whole day while they're in poop and urine. What's the purpose of us paying for that? What's the purpose of us paying for that? And when I say us, not me. You understand? What is the purpose of the insurance company or the patient's insurance paying you for that? That don't make no sense. It's not benefiting the patient. It's not benefiting the patient, because every time you go in and you realize that this patient is in poop and this patient is in urine, it is what? Neglect. You have to go and report it. You have to report it to the right person so they can address it. But before I normally do that, I usually talk with the home health agencies to find out, why can't you find somebody else to fill that position who is willing to make sure that the patient's need is being met? Because it's unfair for the patient to have somebody who is acting in the capacity of a home health aide and not being able to change the patient when the patient is, you know, peeing and pooping on themselves the entire day. When the wife is out, you have a patient who is home for the next, 8 hours? When the wife is out, how many times am I going to pee and poop on himself? How many times? This patient is going to have to lie down in his poop for the whole day and urine for the whole day until his wife come home. So you're telling me that if this patient has diarrhea, how many times he's going to have to do that? It sounds gross, right? Exactly. It is unfair. So these are the things that I experience on a daily basis. Not every single day, but it is very, very concerning out there for a lot of the patients that I see on a daily basis. And these are the things that breaks my heart, because when it comes down to elderly care, a lot of times I'm like, you know, you're thinking that the family members are supposed to be going above and beyond to take care of their family members, but really and truly not all the time they are doing that.
Take the I-35E North ramp.
Some persons are against nursing home, some persons are against group home, but may I tell you that when you look at where some of these patients are at in terms of like their home, away from home, so some persons are against nursing home, group home, but I tell you, in comparison to some of the homes that I've visited, the patients in the nursing home and the group home are being taken care of a little bit better than in some of these homes, because nobody really is taking care of them. You understand? Nobody is really taking care of them. But let me know what you think about it. If you are the home health aide and you're related to the patient, do you go ahead and change the diaper, or you don't change the diaper when you're bathing the patient? Because to me that don't make no sense. If you know you're not gonna complete the task of cleaning the patient entirely, don't take the job. Don't take the job. Because for me, I don't like changing diapers. I don't like poop. I don't like suctioning. I don't like vomit. Yes, I'm a nurse, but I don't like it. Do I refuse to do any of those tasks whenever my patient poops, vomits, needs suctioning? No, I don't. I still go ahead and do my due diligence. You understand? It's a part of my scope. When I was in training, if we know that definitely I never wanted to do it, then what I would have done is step aside from it, because we know that I would have to encounter it in my career.
Use the left
You
two lanes to
understand?
take the I-35
So the training ground is the part where I would have made
left.
my decision to say that me no want to do this anymore. But I continue in the pathway because
left.
I said that this is
Continue
something
on
that
I-35 south for 4 miles.
this is something that I will be dealing with. I am open to, and it is gonna be a part of my lifelong career. So you have to kind of buckle up yourself and tell yourself that yes, even though you don't like it, or even though I don't like it, I still find the strength to do it. Will I be doing it on my relative? It depends. You understand? It depends. And there are certain times when it comes on to your own relative, you have to know when to say no and when to say yes, and it depends on what you're going to be saying no and yes to. You understand? You have to know when to say yes and no to your relative. So if you know that it's a young person, if I know it's a young person, and as I say, it depends on the relative. It depends on the relative. Because if it's my grandparents, yes, me I go below the waist. Nothing wrong with that. And you just have to know yourself, and that's just the end of it. You just have to know yourself. If it's my brother and me have to take care of my brother, you just have to trust yourself. So at the end of the day, it's all about trust and you knowing yourself with the person. So if you feel as though it is something that if you know you can't trust yourself, then me totally understand. You try and avoid certain, situation. But aside from that, to me, I don't know. I don't know. But at the end of the day, for me, it's all about trust. Trusting yourself and how you feel about the situation. But if you feel as though it's not a situation where you can go below the waist, you don't take the job. Because that part of the job is very important, especially as a home health aide. Because when we assign patients a home health aide, we are assigning them because we know that the patient is not able to do anything. The patient is bedbound and the patient needs bathing, they need feeding, the patients need bathing, the patients need feeding, and those are the primary responsibility of a home health aide. Alright? So let me know your thoughts on this, and then from there, I will keep you posted in more content. Until then, I'll see you. Bye.